can understand how being a mom and a parent that you can be hesitant about vaccinating your kids.
Local doctors and lawmakers come together to urge parents to make sure their kids are up to date on the measles vaccine. Right now, there are more than 800 cases nationwide, 70 hospitalizations, and 2 children have died from the illness. And while the biggest outbreak is in Texas, our local health leaders are keeping a close eye on other clusters closer to home.
We have significant outbreaks that we are concerned about. One in Ontario, Canada, that's much closer to us than the outbreak in Texas. We've seen cases now in a number of other states across the country. These vaccines are safe. They are not related to increased rates of any kind of illness, and that the deaths of 2 children from measles should not happen in this day and age.
The CDC recommends children get the first round of the measles vaccine at a year old and the second booster right before kindergarten. But as News 10 NBC investigative reporter Jennifer Lukey shows us, a growing number of families are delaying the decision on whether to vaccinate at all.
For decades, most parents just trusted the doctor and allowed the recommended vaccinations for their kids when they were due. But doctors nowadays are spending a lot more time answering questions in the exam room, and they don't always get a yes at the end of those conversations.
My name is Morgan Timmich.
Morgan Timmich is a proud mom to her 6-month-old baby boy, Noah.
But he's babbling, he's smiling, he's rolling over one way. You know, we're trying to get him to roll to his back. He loves people, he loves daycare. He just really is the best thing. Me and my husband say it every night.
She's spent a lot of time around babies.
And I spent 8 years in the NICU, taking care of the most vulnerable patients.
But it's different when it's your own.
I can understand how being a mom and a parent that you can be hesitant about vaccinating your kids.
Since the pandemic, local pediatricians have seen a steady increase in vaccine hesitancy, and not just COVID or flu shots.
I have this conversation literally every day in the office. It takes an inordinate amount of time. But I want parents to feel comfortable.
So grateful for everyone being here.
Today, she joined Congressman Joe Morelli to encourage parents to vaccinate their kids against measles as the illness makes a resurgence across the country.
We need to push back against disinformation, reaffirm our commitment to science, and ensure that families have the support they need to keep their children safe. So their future depends on the choices we make today.
Noah will be getting his first dose of the measles vaccine when he turns 1. And local doctors say they'll continue to expand the appointment times for parents who aren't sure whether to have their babies follow in Noah's footsteps.
Our role as physicians is not just to treat, but to listen, to answer questions, address concerns, and provide the best possible guidance based on evidence and compassion.
Bottom line, if you have questions or concerns, bring them up with their doctor, have that conversation, and then decide from there. Jennifer Lukey, News 10 NBC.
Current HHS Secretary Robert F. Kennedy Jr. has said he is putting together a task force to reassess the current vaccination schedule. As it stands right now, the measles vaccine is required for students entering public school here in New York.